If you have hip or knee pain and your doctor recommended using a rower, stick around because I'm going to show you 4 creative ways to use a rower for your hip and knee rehab at home. Studies show that rowing machines can recruit up to 86% of the major muscles in your body, which makes it one of the best exercises out there. And that's not just my opinion as a physical therapist, that's backed by research. There are some safe and effective ways you can use a rower when dealing with hip or knee pain, and I'm going to show you 4 techniques that I teach my patients. And you can use any rower, but I'm going to be using this water rower by Ergatta. It's the one I recommend most for my patients, but more on that later. Hey, by the way, if you're here because your doctor recommended rowing, let me know in the comments what kind of issues you're experiencing and how I can help with future videos as well. Now let's get started with using a rower for rehab after a knee injury. If you've twisted your knee or you have a non-surgical injury, you can use a rower to work on range of motion, improve blood flow, and even maintain or improve your strength. The same principles apply for knee injuries that require surgery, like an ACL repair or even a total knee replacement. But you want to make sure to follow your doctor's recommendations on when you can start using equipment like this. My first priority is to work within a safe range of motion. You should feel in control of the movement the entire time, and one of the best ways to do this is by keeping the recovering leg outside of the rower. This is the first technique. Place the foot of your injured leg in front of the footrest. This will allow your knee to still bend, but in a more restricted range of motion as you push off with your good leg through each stroke. Eventually, you can start to bring in your injured leg closer to allow for an even greater bend, even pushing against the ground for some initial resistance. Once you're able to bend your knee to 30 to 40 degrees without pain, you can sit in the rower and limit how much you flex your knee into the catch, also known as the starting position. If you're experiencing pain in your hip, this can also be an excellent technique to help with your recovery. That's because positioning your foot outside of the rower can help to decrease that pinching feeling that you may be experiencing in your hip. The same principles here apply though. You want to control that range of motion of that hip. Don't move too quickly into full hip flexion if you're experiencing pinching in your hip. Use that leg out technique to help glide yourself into whatever pain-free motion you have, and you may find it easier and easier to bend at your hip without that pinching sensation as you go into the catch. For someone with hip or knee pain, increasing your rowing intensity shouldn't be your focus for the first week or 2 of your workouts. Think about pain-free range of motion and aim to row for about 5 minutes with a slow and easy stroke. Your pain-free range of motion should start to improve and then allow you to increase that intensity of your training over time. Now, speaking of intensity, one of the reasons why I like water rowers like this one from Ergatta is that you can control the intensity based on how quickly the paddle moves through the water. You'll find that chain-driven rowers use a fan or air resistance, or even really expensive rowers that use fancy magnetic resistance to change the intensity. Those are all options out there, but in my opinion, nothing beats the natural feel of a water rower. Plus, the Ergatta is a lot quieter than air rowers that you'll find out there. The second technique is called a patellar glide, and I love to share this with my patients who have access to a total gym or a rower like this one because it works particularly well when you have knee pain in performing a squat. Now, it's usually the standing motion out of a chair that causes pain in the knee, and oftentimes we can help to decrease this pain by introducing a patellar glide with the movement. To perform this technique, sit on your rowing machine with both feet strapped in. Place one hand at the base of your kneecap of the painful leg. As you extend your legs, apply pressure like you're trying to pull your kneecap up towards your pelvis. Relax the pressure as you move back into the squat position and repeat this patellar glide with every movement as you extend your leg, tightening the quad muscles to achieve that full knee extension. You can use this technique as a warm-up or even a standalone exercise to promote that upward glide of the kneecap, which is one of the best techniques for decreasing generalized knee pain. Ideally, your quads will become even stronger and provide that tension pulling up on the kneecap naturally, but it's a great technique to introduce early after an injury and even throughout your recovery. The patella glide trick also works while you're sitting in a chair and extending your knee, so if you tried this technique while you're watching this video and you're able to do it without pain, let me know by giving this video a thumbs up. Okay, let's talk about pinching pain at the hip. This third technique is helpful for those of you who are experiencing pinching in the hip, especially when you're getting up and down out of a chair or lifting up your leg to 90 degrees. A lot of times the hip flexor muscle becomes irritated because it's constantly firing at that hip joint when you flex your hip, and it can even become painful when you extend your hip. You can feel your hip flexor working when you lift up your leg like this, and even feel that muscle punch up into your thumb if you place your hand over your thigh at the top of your pelvis. Now we can use a rower to help retrain a pain-free movement into hip flexion and extension by working slowly on the rower to glide back and forth, focusing on keeping the hip flexor relaxed. For some of you, it will be helpful to place your thumb along your hip flexor to feel the muscle and to provide feedback in order for you to help keep that area as relaxed as possible. Now, it may seem counterintuitive to perform an exercise while trying to stay as relaxed as possible, but the point here is that your hip flexor muscle is probably turning on way too much, and the rower is a great way or an opportunity to glide back and forth with as little effort as possible so that you can retrain this motion without that painful contraction and catching of the hip flexors. Try to perform 2 to 3 minutes of this assisted gliding motion of the rower, doing your best to keep that hip flexor muscle relaxed as your seat moves along the path of the rower. Just use the gliding motion of the rower to work into that pain-free hip motion, keeping that hip flexor as relaxed as possible. All right, before we move on to the fourth tip, be sure to take a look at the description below for a summary of these points and a link to my full review of the Ergatta rower. It's the rower I recommend most to my patients because I love the feel of that water resistance and that you can adjust the intensity based on your stroke as the paddle flows through the water. Plus, with the Ergatta rower, you have access to a library of interactive rowing games, tutorials, beginner to advanced workouts, and even scenic rowing experiences that can take you all around the world. Now, the truth is, the best workout machine in the world is the one that you'll actually use, which is why I love the motivating programs that you can get with the Ergatta rower. They make it so easy to want to get on this rower, and hands down, it's the most beautiful piece of workout equipment that I own, and I'm sure you'll love the look of it. You can see my full review in the description below. Now, let's take a look at the fourth tip for using a rower for hip and knee pain recovery. The fourth tip is to be very aware of what muscles you're using. Now, you can get a fantastic workout targeting your glutes, your quads, and even your upper body when using a rower, but the mistake I see most people making is using too much upper body and not pushing enough through the legs during the drive. Think legs, hips, arms as the sequence of muscles involved during the drive. You may be surprised to know that rowing is primarily a leg and hip driven movement with the upper body working to finish out the stroke at the end of your drive. You should feel your glutes and your quads engage as you drive through your heels and extend your legs with each stroke. Now, regardless of whether you have hip or knee pain, strengthening your entire lower body and improving your ability to contract your quads and your glutes at the right time is going to be huge to help as you work through your rehab at home. When you can achieve that full cycle and full range of motion without any hip or knee pain, you're ready to increase the intensity and the time you spend rowing, which will increase your cardiovascular endurance, your strength, and your overall conditioning. Hey, I'm glad your doctor recommended that you consider rowing to help with your hip or knee pain. I hope these tips and tricks help you as you work through your recovery at home. Be sure to subscribe to the channel so you don't miss additional videos with tips and tricks. You can read my description below for all of the reviews of this rower and other videos that may help you as well. So thanks for watching, and I'll see you in the next video.